To order. This is Wednesday, September 18th, 2024, and we are here to take public comments on the adoption of a new fee increase for the Shoshone Ambulance District. It's a public hearing. I will entertain, or I guess we'll go into, take a roll call, go into public hearing. Motion to go into public hearing. You second it?
I'll second. Okay, you made the motion.
Sorry. Aye.
Roll call. Commissioner Cassidy.
Here.
Commissioner Zimmerman.
Here. All right, we're in session. Okay, go over some rules and procedures for the public hearing. We have a signature sheet here, so if people for or against can sign in, or neutral. And no person shall speak before the hearing body until such person is recognized by the officer. All public hearing proceedings shall be recorded electronically, and people shall speak clearly and loudly enough to assure the testimony is recorded clearly and correctly. No person shall interrupt the speaker. Any speaker who has evidence of any kind shall submit that evidence to the staff, and it will be entered into the record. 4 copies of each document and photograph item of evidence shall be provided and shall be marked for identification purposes. County staff exhibits shall be alphabetical, and all public exhibits shall be marked beginning with P following by the appropriate numerical character. People attending the public hearing shall engage in a respectful manner. Any action taken that disrupts the proceedings or endangers others may result in prompt removal. Once the chairman declares the hearing closed, no further evidence or testimony shall be presented. Okay. We don't have any, we have one public, we got comments here. Okay, staff report. I'll let you go ahead.
Okay, so what really brought this whole conversation up was the third-party building company that we contract with. They're the ones that let me know that our rates are significantly lower than a lot of people across the state, specifically related to our fuel charge, with the rates across the board. And it sounds like they have not been increased since the ambulance district was formed. That was, what, 3 years ago now? I don't know the exact date.
Close, yeah.
So I wasn't really sure even where to start with where the rate should be. And so she sent me a document that had all the rates of the ambulance companies in Idaho that they contract with. And so we just kind of went middle of the road. We didn't want to go to the high end just because I want to try to save the taxpayers as much money here as we can. We also wanted to make it to where we're covering our expenses. Since you guys know, all expenses, medical expenses especially, are just skyrocketing. And then she also recommended implementing a in-county versus out-of-county rate, which a lot of places do. And she said, especially in tourist areas, where you get a lot of people from out of the county that are utilizing the services but are not paying in the taxes at all.
Yeah.
And so that's what we proposed. Now, there is a large volume of our population that this isn't going to affect at all, because Medicare and Medicaid transports, they pay a set rate no matter what we bill them. So this rate increase is not going to affect anybody in the county that's on Medicaid or Medicare, because this won't, even though the rates go up, they're still paying the same amount. So it's only affecting the people with private insurance or those that don't have insurance. Now, there is still something in place if people do not have insurance and they can't afford the bill. There's paperwork that they can file that comes to the billing company and then comes to me while we review it. And we do write off a handful of transports every year for people that just don't have the money to pay. So even though the rates will go up, there's still an avenue where people can get out of paying their bill if they just don't have the funds. I mean, we don't want to make a super big hardship on a community member just because the rates are going up.
Okay.
And then the other part of the increase we're asking for with this is billing for some of our non-transport calls. Historically, we've only billed transport calls, and Medicare, Medicaid, and most insurance companies will only pay if you transport, historically. But now that we've added paramedic level services in, we're going on more calls where we're doing a lot more invasive procedures and using medications and using a lot of things that are expensive for us to replace. And then the patients are electing either not to get transported or they expire and don't get transported. Where before, if we had a cardiac arrest, the EMT levels, they by law had to transport him to the hospital. Now with the paramedic, we don't. So we will spend a lot of money trying to resuscitate somebody and then they don't transport it, so it's not billable. So now we're trying to add that fee in where we can submit just for reimbursement for some of the supplies that we're using. Basically, it's not near as much as a transport bill, but it's just a re-expense or reimburse us for the costs that we're putting out for these people that are not going to the hospital. But that's only a slight number of calls. If we just go and do an assessment, evaluate somebody, we're not starting IVs, we're not giving them any meds, we're not doing anything, we're just evaluating them and then they don't want to go, then there's no charge for that.
It's only when you use
It's
supplies.
only when we're using, and it's like starting IV, giving meds. The supplies are expensive.
That makes sense.
Even if we like the one on monitor and we use the stickers for that, we're not charging for that. It's just, but if we do the patches where we're defibrillating somebody, the patches are like $45 a piece, and so some of that.
Diabetic calls would also be one of those that we go on frequently that we can correct that issue if they don't want to go.
Right. We're starting an IV. We're giving them IV glucose. They wake up. They're doing much better. We take the IV out, leave them. Well, then at least we can reimburse the costs.
All right.
Makes a lot of sense.
And that was Chief Dietrich from Fire District 2.
That's me.
That's, yeah. And so,
Yeah.
well,
For the record.
For the record.
Yes. I'm sorry.
I'm sorry. And we have another, we have Chief Miller from Fire District 1 in support.
Yes, sir. I'd pretty much echo John Miller, Fire District 1. Would echo everything Chief Dietrich was stated.
All right, you have any questions for them?
No.
Okay, we have a public comment. and
Yeah, I'm
you're
all
neutral.
I'm all for raising these. The only question I have is clarification. Is non-resident of Shoshone County or non-resident of the district?
Shoshone.
Okay, that's all I got.
Okay. Do you have any other questions or anything?
No.
Okay. We've already heard from testimonies and there's no rebuttal. We didn't receive any objections or anything from the public on this. Okay. I'll do a motion to close the public hearing.
Second.
All in favor?
Aye.
Aye. Okay, now we're in deliberation. Each commissioner member, any thoughts and concerns in discussion of the application?
No concerns. I see the need for it to continue the great service they're doing throughout the county. And
I would agree as well. I think, the cost of pharmaceuticals, that, we saw that go up quite a bit over the last year. Okay. All right, you want to do a motion to approve the,
yeah, a motion to approve the new fee schedule as presented.
okay, I'll second it. All in favor?
Aye.
Aye. Okay, motion carries. The fee schedule is passed.
Thank you both.
And motion to adjourn? Adjourn.